Alrighty, we will go ahead and get started. Welcome everybody to our Missouri Open Door Benefit Series for October. Today we are going to be talking about what's new for 2026 Medicare Open Enrollment. My name is Angelina Alpert. I am a Senior Program Area Specialist at UMKC IHD. And this series is sponsored by Medicare Improvements for Patients and Providers Act, also known as MIPA. Priorities 1, 2, and 3. Priority 1 is Missouri SHIP, which is our state health insurance assistance program for the state, and they will be presenting today. Priority 2 is Missouri Department of Health and Senior Services on behalf of the area agencies on aging. And then priority 3 is UMKC IHD as the no wrong door designee for the state of Missouri. So for anybody new to Missouri No Wrong Door, it aims to transform the way people access services in the community. So it supports individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports, regardless of age, income, or disability. Shared on the past few series, but Missouri was awarded with a new No Wrong Door grant. So we are continuing to work with the Department of Health and Senior Services and all of our other partners across the state to continue working on Missouri's No Wrong Door infrastructure. So a little bit more about our Open Door series. Our goal with those is to open doors to integrated supports. So as you can see here, this is our integrated support star that has 5 different types of services and supports on it, which are personal strengths and assets, relationships, eligibility specific, community-based, and technology. So we currently have 2 series, one of which focuses on technology. Those are the 4th Wednesday of every month from 12:30 to 1:30. The next one is going to be October 22nd on gift giving for loved ones with disabilities. And then our other one is on eligibility specific supports. That is the one that you're at now. Those are the 2nd Wednesday of every month from 12:30 to 1:30. And our last one of the year on that is going to be November 12th on the Master Plan on Aging. Before I hand it over to Gary for his part of the presentation, just want to let you know that this will be recorded and posted to the Life Course Nexus YouTube channel, as well as sent out in a follow-up email. And if you have any questions throughout the presentation, feel free to use the chat to put them in there, and Gary will get to those at the end. All right, Gary.
All right. Thank you, Angelina. So as the title slide says, we're going to talk a little bit about Medicare open enrollment and the drug plan comparisons. So really the goal of this is just to give you an overall understanding of what open enrollment is all about, when it is, what you can do, and kind of how to go about that, things to look for. So hopefully we'll cover all that. And just a little bit about your presenter here today. So I'm a member of the strategic outreach team. So at Missouri SHIP, we have several individuals that work trying to figure out how to reach more Missourians with the message of Medicare outreach. So there's about 1.4 million Missourians with Medicare. We're a small staff with a group of volunteers that help us with the outreach as well, but we need your help as well. So we're happy that you're here on this webinar. I'm also a volunteer counselor, which we'll talk about kind of how to go about being a volunteer counselor later in the presentation. So, but rewarding a rewarding thing if you ever are looking for something to do in your retirement or off time. So just a quick disclaimer. This presentation is intended for Missouri Medicare beneficiaries and their family or caregivers, not for the media or licensed health insurance professionals. If you're one of those groups, if you're an agent or whatnot, or a member of the media, you should contact the Missouri Department of Commerce and Insurance. And I'll give you a minute to drop off the webinar if you happen to be logged in and not intended to. So All right, let's talk a little bit about Missouri SHIP. As you can see there on the right, the Department of Commerce and Insurance is actually a grant holder for from CMS to fund Missouri SHIP. So every state has a SHIP. So the Department of Commerce and Insurance awarded that to us in 1993. We've been doing that ever since. Um, and SHIP stands for the State Health Insurance Assistance Program. And as I mentioned before, the counselors, we've got about 100 and between 170 and 200, depending on the time of year, trained counselors that are certified in Medicare uh, advocacy and education. And these are the folks really on the ground that provide the education and advice to Missouri beneficiaries that call into our contact center. And really the goal of us is really to be there when you need us. So we help you make the decisions about your healthcare needs. Um, we don't make them for you, but we're there to support you, to answer your questions, and to make you aware of your options. So as I said before, every state has a SHIP, and they're called different things. We used to be called Missouri Claim. We were rebranded a few years ago to Missouri SHIP. So that branding has been complete. I think that's working well. Um, we also give feedback to the state and to CMS themselves as far as things that we see. And probably the biggest thing to remember is um, Missouri SHIP counselors are independent and unbiased. So what that means is we don't promote any specific product or specific company. We can't have represented a company, worked for an insurance agency, for instance, for up to 2 years before becoming a Missouri SHIP volunteer. So we don't want to have any of that bias going into it. We just want to get you the information so you can pick the best product that's the best for you. So as far as a counselor goes, we kind of wear a lot of hats, and that's what makes this role or job pretty interesting, is because during this time frame, the open enrollment, it's really kind of our Super Bowl, if you will. That's when we take the most calls throughout the year, the biggest volume of calls because people are comparing their drug plans, their Medicare Advantage plans, and just their overall health plans. So we can help them with enrollment in plans like a Medicare Advantage plan if you wanted to enroll in one or switch to a different one. Um, we can help you with a standalone drug plan. Um, if you have original Medicare, we can advise you on, what's out there for Medigap on the supplementary insurance plans. So if you have original Medicare, a supplement plan helps you insure the part that Medicare doesn't cover. So typically that's an 80-20, Medicare covering 80%, your responsibility for 20% on Part B items. So the Medigap kind of helps cover things like deductibles, like if you checked into a hospital, a deductible might be about 1,600 plus, depending on the year. So those plans insure those type of claims, kind of provides a backstop because original Medicare really doesn't have a maximum out of pocket. And so it's important to know that going into it that, um, you know, your 20% could go up and up if it's a long-term hospital stay or something like that. Advantage plans are certainly becoming more popular. About 50% of the Missourians have Medicare Advantage plans. The other 50, of course, have their original Medicare. So it's about an even split. Again, just depends on what your needs are and what you're looking for, which is the best for you. But that's probably one of the biggest questions that we're asked is, should I get an Advantage plan or should I go with original Medicare? And so we don't say go with one or the other. We say, well, here's the pros, here's the cons of each, and how does that fit with your philosophy? The Medicare prescription drug plans, those are individual plans by private insurers, and we can help review those, input your drugs, see how those work out for you. We can also help you save money with making sure that you're applied for any subsidies that might be out there or it might pay for your Part B premium of $185 a month in 2025 or drug plan, that sort of thing. We can also help with appeals or grievances. If you think a claim should have been paid and it wasn't, we can help you file a grievance or an appeal for that process. So, and we work closely with the Senior Medicare Patrol or SMP to be able to report suspected fraud, waste, abuse of some sort. So today we went over the general information with Missouri SHIP. And again, just quickly, we're going to talk about what is open enrollment, what are the special enrollment opportunities, advantage changes, Part D drug plans, Medicare Plan Finder, and how Missouri SHIP can help you. So let's go ahead and get right into it. So what is open enrollment? Well, it's coming right up. So we're at October 8th in another week, and open enrollment's going to start beginning October 15th through December 7th. And so, as I said before, that's kind of our Super Bowl. So for most people, this is the only time you can change how you get your Medicare benefits. And so that means, am I going to get those benefits through original Medicare and a standalone drug plan and a Medigap plan, or am I going to get those through a Medicare Advantage plan with a built-in drug plan with that, or how we're going to do that? So you can review those and make changes, and all those changes that are made during this open enrollment time. So from October 15th through December 7th, those will take effect January 1st. So you can make as many changes as you want during that time frame, but only the last one is the one that's going to stick for beginning January 1st. So you can make a change and change your mind, make another change in November. That's fine. Then you change your mind again. You get the idea. So the last one is the one that counts for you. So the interesting part, and I'll say interesting / sad part of open enrollment, is over half Medicare beneficiaries don't review their coverage options annually. And so what that typically means is you may be leaving money on the table. So nobody likes to overpay for anything, whether it's a hamburger or your health insurance. So what we encourage at Missouri SHIP, we encourage beneficiaries each year, even if your plan worked wonderfully last year, we say you got to review your plan because things change. Plans change. So maybe it worked great last year, but they changed some things. And if you don't know that, you're going to assume it's going to be the same, and it's not. They may have changed their formulary, which means what drugs they have and what tiers and what prices they charge for them. And so with that, it just pays to compare. One of the things that we're very proud of at Missouri SHIP is that on average, we save Missouri Medicare beneficiaries $2,000 a year on their prescription drug plans when they come in to do a review. And that's real money to anybody. So that's why we say come in. It only takes an hour, and you'll have that peace of mind knowing you've got the best plan going forward for the next year. So exactly, we talked about when, right? So prior slides were October 15th through December 7th. And then what? What changes can be made during annual open enrollment? Good question. So again, we talked about two different ways to get your Medicare: original Medicare or a Medicare Advantage. And so if you're on original Medicare, or sometimes we call it traditional Medicare, you have Part A and B, which Part A is your hospitalization, Part B is your doctor or outpatient. You can switch to a Medicare Advantage plan during open enrollment. So it's a fairly easy thing to do. You may say, boy, my expenses for vision and dental were really high last year, and original Medicare doesn't pay for any of those charges typically. So I want to change to a Medicare Advantage plan that may have dental coverage, vision coverage, hearing aid coverage, a built-in drug plan, and any other extra benefits. So you can do that during the open enrollment, and it will be effective come January 1st. Maybe you're already in an Advantage plan, but those change from year to year. Even the same plan can change from year to year. I guess that's one thing I want to stress to you is even though it worked great last year, every plan probably is going to have something change, and it might be to your detriment. So things like, can I see the same doctors? Because in a Medicare Advantage plan, you typically have to see doctors in network in order to get the best pricing. With traditional Medicare, you can pretty much see any doctor you want. There is no real network other than do they take Medicare. And so, you want to make sure that you can still see your providers, your labs, hospitals, dentists, things like that. So make sure that you can see the providers that you want to see. So choose or switch between Medicare Part D prescription drug plans. So again, if you're on original Medicare and you have a standalone prescription drug plan, and we talked about those being issued by private insurers, right? So you've got 20 or 30 of those plans typically in a zip code out there that you can choose from. Well, how do you know that you're in the best plan? I mean, we'll go through and kind of later on in the presentation and show you kind of how to do that. But clearly you need to make sure that the drugs that you're taking are still covered satisfactorily for you. If you are already a Medicare Advantage and you want to switch back to traditional Medicare, you can do that too. Now, this gets a little trickier because typically when people have original Medicare, because it's an 80-20 and because there's no maximum out of pocket for traditional Medicare, people typically want to have a safety net, if you will, for that maximum out of pocket. So if you had a heart attack and you had a $500,000 bill, and you had to pay a big percentage of that, that's a lot of money. So you want a cap. So typically that's provided by a Medigap plan. And so depending on how long you've been on a Medicare Advantage plan, when you got on there, is it the first time you've been on or whatnot, you may or may not be able to get a guaranteed issue for a Medigap, which means you might not be able to get that safety net on a traditional Medicare platform. So something to keep in mind. We'll talk more about that in a little bit. So again, this is kind of Super Bowl time. But there are a certain number of criteria where you can make changes outside of that, October 15th through December 7th. One of those is you can switch to a 5-star rated Medicare Advantage or Part D plan. And what that is CMS gives these plans ratings, 5-star ratings. And when you go out to Plan Finder, which we'll show you in a little bit, it'll say, is it a 1-star? Is it a 5-star, 4-star, 2.5, any range. If there's a 5-star plan out there, you can switch to it outside the enrollment dates. They want you to be able to take advantage of the best plan. If you've had a disruption in coverage, which could be your provider left the area and said, nope, we're not going to cover a certain zip code anymore, and that's the zip code you were in, you'd be able to go ahead and make some changes because that's no fault of your own. Changes in eligibility, maybe you were working past your retirement age or your Medicare age, and you had group health insurance, but now you decided to retire. So you're going to have a special enrollment period because you're losing a group health insurance. So things like that. If you're on a subsidy plan like Extra Help, which is provided by Social Security, that helps pay your premiums, your deductibles, copays, that sort of thing on your drug plans. If you have that, you can change outside of that open enrollment period. So speaking of extra help, um, a recent change was it used to be you could make changes quarterly. They changed that to now if you're on extra help, you can switch monthly. So you can switch between standalone Part D plans. That comes in really handy if your meds change midstream and the plan that you chose last month doesn't cover a certain medication very well. And you say, I'm going to do a search and see if another plan does better. And so you can switch if you're on extra help. You can also move from a Medicare Advantage to original Medicare Part D. Um, things that you can't do, you can't switch between Medicare Advantage plans. So you can't every month, you can't say, I'm on this plan this month, I'm going to switch to the next plan the next month, that sort of thing. And you also can't enroll in a Medicare Advantage if you're already in original Medicare during the special enrollment. So um, the changes that you'd make would be effective the first day of the following month. So it's a very quick change for new coverage. So that's a great benefit. Okay, let's talk a little bit about Advantage plans. You know, one of the things that I'll just mention, and typically people want to say, well, what's changing in Medicare this year? Well, Medicare typically makes us wait a little longer before they announce a lot of the changes. Um, we do know things like the out-of-pocket for a Medicare Advantage, uh, and that just means the amount that you are going to be responsible for once you hit that certain out-of-pocket amount, then that plan is going to pay 100%. So we know that that changes from year to year. So that's one thing. On the drug plan, we know that the maximum out of pocket's changing from 2,000 to 2,100. So $100 change. The drug plan, the maximum deductible went from 590 to 615 a year. And so that's going to impact your plans a little bit. Part B premium, to my knowledge, they haven't announced what that's going to be this year. It was 185. I believe that it's going to be over 200 next year. But again, that hasn't been formally announced. So I don't really have any inside information other than, what I read, just like you could read that what they anticipate the price may be. So, one of the things you may be asking is, man, it seems like there's a lot of moving parts. How do I know what's changing? Do I just get on the internet and get on my favorite search engine or Chat GPT and say, hey, tell me what's changing in my plan? So there's several things that are provided to you that help you know what the changes are. One of them is an annual notice of change. And so every fall, your Medicare Advantage plan should give you a notice of change that tells you, did the premium change? Did the deductible change? Did the benefits change? Same with drug plans. There should be a notice that comes out that says, hey, this is how the drug coverage is going to change on this plan. So you should have already received that from your plan. If not, go ahead and contact your plan and say, hey, I haven't gotten this. Or you can probably go out to their website and find an annual notice change letter. So that's one thing that I would encourage you to read very carefully. If you read nothing else, I would say read that, because that tells you the landscape for the upcoming year. And that will also tell you or might give you a good clue on whether or not you need to look for a new plan. So look for that. I would save that. Even if you don't do anything, I would put that in a file for your Medicare 2026 And if you don't have a file, I would set one up. Just helps you stay organized and kind of remember what came to you. I can't tell you the number of times somebody will say to us, well, I never got any notice of that. And maybe they didn't, but chances are there's so much information that comes at you. It's pretty easy to look at something or, open it up and then say, oh, I'll read it later and forget it came or forget to review it. So just think about that. Okay, if you're in an Advantage plan, you also have an extra enrollment period. So as we said before, you can make changes during open enrollment for your Advantage plan. You can also take advantage of an open enrollment period specifically for people that already have a Medicare Advantage plan. And that runs from January 1st through March 31st. And so if you're already enrolled, you can make one change during that time frame. And whenever you make it, the change is going to be effective the next month. And so that's a good thing. You can also use that time frame to change from an Advantage plan back to original Medicare. And we already gave you the caution kind of for switching from Advantage to original, in that make sure you can get your Medigap if that's something you want, because you may not be under a guaranteed enrollment period. So you may be subject to underwriting. You could be subject to them just saying, well, we're not going to issue that to you. We don't want to take that risk because of your health and underwriting. So it's a good thing to take advantage of, to know that you can still make a change through March 31st if you already have a Medicare Advantage plan. So again, things to consider if you want to switch from an Advantage to, and this is Medigap, it's really to original Medicare and a Medigap, is if you're going back to original, it's kind of an 80-20 co-insurance typically, along with deductibles. So, if you went and again went into the hospital, you'd have a deductible of $1,676 for the first 60 days. So if you're admitted, you're going to have that to contend with. If your doctor bill, you're going to be paying 20% of that doctor bill. And so keep in mind if that's okay with you. And again, without a catastrophic kind of safety net, if you will. Do you qualify for the Medigap without underwriting? So maybe you're healthy and you would pass with flying colors. That's great. But there's also the chance that if you have high blood pressure, diabetes, a heart condition, cancer, that you might not qualify for that Medigap. They might not write you. So before you make the switch, make sure that you can get that Medigap. And again, if you're going to switch, if you're switching from an Advantage plan, it likely had a built-in drug plan for probably no additional costs. Well, going back to original Medicare, don't forget you're going to have to sign up for a Part D prescription plan from a private insurance company, and there'll be a premium associated with that. And so the other thing to remember is, again, if you're used to getting your dental paid and vision paid and hearing aids paid for from an Advantage plan, original doesn't cover that. So those are going to be out-of-pocket expenses for you. So those are some things to consider if you're going to switch from Advantage to original with a Medigap. So let's say you want to go the other way. Now you want to switch from original to Medicare Advantage. Less moving parts with this switch. So if you decided that you're kind of tired of paying for a separate drug plan, you're tired of paying the Medigap premium, maybe you just can't afford that anymore, then you're going to switch to a Medicare Advantage plan. And some things that you want to consider: the maximum out of pocket. I mean, anywhere from say $3,000 to nearly $10,000 could be the maximum out of pocket for on an annual basis for a Medicare Advantage plan. So of course you'd like to have one as low as you can get. So you'll be looking at that. Again, now you're back in the network. So kind of like probably what your group health insurance used to be when you worked at your employer. They all have networks. So similar to that, an Advantage plan has a network that you have to stay within. Are your doctors and hospitals in network? That's one thing you want to look at. Otherwise, your prices will be either higher or they may not be covered at all. So that's a very important thing. I've had people, I helped one lady that came to me and said, hey, I switched to an Advantage plan because I got a free gym membership, silver sneakers, but I couldn't go to my doctor's. And it's like, so maybe the priorities were a little bit out of line with how you were measuring whether a plan was better than another, or whether an Advantage was better than the original Medicare and that kind of thing. So what I tell people is probably the top thing is, can you see your doctors and go to your hospitals in network? Um, then kind of the max out of pocket. After that, I'd probably look at the drug plan cost and see what your drug plans are going to cost you through that Medicare Advantage plan. And so, and then, some of the supplemental benefits we just talked about, an example of a gym membership, one of the questions is, are you going to use it? It's nice that it's out there, but if you're not going to use it, it really doesn't factor into your decision making. And so that's really something to keep in mind on the switching. And again, at Missouri Ship, we can help you kind of walk through some of these things and help you kind of put the pros and cons down on paper and the steps that you need to go through to switch from original to an Advantage or vice versa. So it may sound a little daunting, but there's lots of professionals at Missouri Ship that can help you walk through that process. So let's just take a minute and, I've kind of been giving you a lot of information. So let's kind of take a minute to just take a little quiz. And so if I choose a Medicare Advantage plan, I can never switch back to original Medicare. True or false? And I'm going to give you just a second to think about that. Okay, let's reveal the answer. Yep, there wasn't an answer there. Okay, I thought we had one there. So yes, you can switch back to original Medicare during this open enrollment period, as we kind of talked about. But we did that with cautions about the Medigap. Again, I know I've mentioned that several times. That's because I think it's very important for you to know. But no, you can switch back either way, Advantage to original or original to Advantage. Okay, Part D, prescription drug plans. So again, we talked about these being private plans from private insurers. So outside of really they're approved by Medicare, their plans are, but again, you're going to send those premiums to your plan provider. And so that's what adds your prescription coverage to original Medicare. So are they required? No. But you may be penalized if you don't get a prescription drug plan when you're first eligible, and then later on decide, I'd like to get a prescription drug plan now because now I've got a bunch of drugs I'm on, and maybe when I first signed up I wasn't on any. And what we tell people is, you're better off joining a low-cost prescription drug plan if you're not taking any drugs. Go ahead and get a low premium plan, because then the penalty clock doesn't start. And so, the penalty is an extra 1% for each month, or 12% a year that you could have signed up, but you didn't. So you've got 63 days to sign up for a drug plan after getting your Medicare. So availability based on your zip code. And we talked about the private insurers. And, kind of one of the nice things about a drug plan with the Medicare Advantage is it's kind of like it used to be with your internet and cable and phone. They'd like to bundle them. The Medicare Advantage, or Part C as it's called, often combine a drug plan with your Part A and your Part B plan, as well as, again, those vision and dental benefits. So kind of a convenient way to get your drug plan. So when you're considering a drug plan, what do you need to think about? And I get a lot of people again, and some of this is a repeat, but I think it's worth repeating. Um, if someone's plan worked well for them in the prior year, they typically don't want to take the time to do a review. And as we said before, that's a mistake. You want to check every year um, on whether there's a better plan out there. Because again, if you go back to one of my original statements that on average, we save people $2,000 a year on their drug costs by reviewing their plan and enrolling them in a different plan. Um, and again, we at Missouri Ship, we don't sell anything. We don't have any allegiance to any plan. We just look, and by using your drug list, we'll see which pharmacy and which provider will cost you the least amount of money for your drugs. Now, one of the things I will say is, you know, I wish, people had a crystal ball because, one of the shortcomings is, well, your prescriptions might have changed mid-year. What do you do? Because maybe the current plan doesn't cover you very well with these new prescriptions, but how are you to know that you were going to be on these drugs when you selected your plan? And that's kind of one of the tough things. You're pretty much stuck with that plan throughout the year, unless you were on one of those extra help where you could switch every month kind of a deals. Um, so that's one thing to think about. You can ask the insurer to make an exception. So that is one thing. They don't have to make an exception to add something to their formulary based on your plan, but um, it's worth a shot. So things to consider, from last time, did my health change? And then that also means, did I delete some prescriptions? Did I add some prescriptions? Am I on a high cost med now? Maybe my doctor doesn't want me to go on a generic, and so I have to pay for a brand. Um, so also, is one of the meds just really high that I can't really afford? So there are things that you can do that impact that cost. One of them is making sure that you're with a preferred pharmacy with your current or your new plan. So it will say, when you look at the plan finder, it'll say in network, it'll say preferred pharmacy or out of network. And it's not a guarantee that the preferred will be the cheapest, but most of the time it is. So that's something to keep in mind, that pharmacies do matter with your cost. And interestingly enough, even the location of a pharmacy, for instance, it could be a CVS, and the prices can be different from CVS to CVS. So the location of that CVS is important to know when you do the plan comparison. Um, so one of the other things on saving money is there are also pharmaceutical companies that will actually have a foundation that help pay for some prescription drugs depending upon your income level. And so that's something also to be able to look at places like Needy Meds or PAN or pan.org, kind of have a clearinghouse of those types of things. So that's something to keep in mind. And mail order, sometimes mail order is the cheapest. Typically, people either love or hate mail order. Uh, Seems like most of the time it's on the hate side, but depending if you don't have access to a car, mail order can be very good. And again, mail order can be the cheapest option sometimes. So it's always good to look at that. Um, Now, one of the things that's on this bulleted list is, well, I'm assuming the premium, the lowest premium plan is the one I want to pick. And that's not the way you look at it, because you really have to look at the lowest monthly premium plus the cost of the drugs, because there could be a plan out there with a very low premium, but their drugs cost more, and that's where they offset it. So when you look at the drugs that you'll be buying throughout the year, all of a sudden you're looking and it's like, wow, that's a big number. I would have been better off paying a little bit for a monthly premium or a little bit more for a monthly premium, but my drug costs were a lot lower. And so Plan Finder is going to help you actually look at that. And speaking of Plan Finder, out at Medicare.gov, you will find this Plan Finder. And this is an invaluable tool, guys. I mean, this is what we use at Missouri Ship day in and day out. And it's gotten better each year that I've been doing this. I've been doing this for a little over 6 years, maybe going on 7. And I think they've done a good job updating. And I think part of that is because we provide some information to them as far as how to make the products better. But with Medicare Gov, once you have a Medicare number, you can set up a Medicare.gov account. And so a user ID and a password, and you don't have to put in much information at all. I believe they want your name, your zip code, your Part A effective date, and your birth date. And I think that's the information they want to set up your account. So then you set up your user account. Typically, people use their email address for their user ID. Then they come up with the unique password. They ask you for a secret answer to a secret question. So to help you reset your password in case you ever forget it. And it lets you compare both Medicare Advantage plans as well as Part D plans. So you'll enter your prescription medications, your how many milligrams, what the name of the med is, whether you want generic or not, how many you take in a month. And then you can select up to 5 pharmacies that you want to compare. Again, we talked about how important that is for pricing. And then you can select the plans to really see how it pays month by month or annually. And then you can select it. Again, don't just get suckered into the lowest premium plan. Look at total drug cost plus your premium cost. Okay, and there is Medicare.gov. Again, and I think we're going to have to go to the next screen. Okay, how much time we've got? I tell you what, Sonia, I don't know if you can give me control or go into Medicare.gov. I could just go for a second if you wanted me to kind of show them Medicare.gov.
You should be able to have control, Gary.
Okay, thank
It
you.
would just take, yeah, it would just take, yeah, you should be able to do that.
Okay, you see my screen?
I'll stop share first.
Oh, okay. So Sonia is on the Medicare.gov account, and we've got the disclaimer that, hey, don't forget the government shutdown up there at the top. Go ahead and scroll down a little bit, Sonia, and I'm going to show them. Thank you. So find health and drug plans. So if Sonia hits that find plans now, it's going to go out and it's basically going to ask you a few questions. So over there at the right, if you don't have a login set up yet, you can still use it as a guest. So Sonia's going to circle in there at the upper right at the login, but let's go down where it says continue without logging in at the bottom. And you see you can compare 2026 or 2025. We'll stick with 2026 and we'll put in any zip code. So 64119, how about with Missouri zip code? And continue. And then it says, what do you want to analyze? Do you want a Medicare Advantage plan, a drug plan, or a Medigap policy? And we can just say, fine, let's go into the drug plans. How about? And it first asks you, do you get any help with your drug costs? So if you're a lower income individual and you've applied for things like extra help, you may, but we're going to say I don't get any help down there at the bottom and continue. And do we want to see our drug costs when you compare plans? Sure. And now we can just enter whatever drugs you happen to be on. So you can enter, and if you start entering letters, it'll kind of come up with some suggestions. So like, yeah, pick any of those, Sonia. And see, it tells there how many milligrams, and it's got a drop down and quantity and every month. So you can select whatever you need there. And then yeah, just add that to your drug list. And we're just going to do one for sake of time, okay? Or two, that's fine. If you want to enter another one, that's great. There we go. Now we'll go down and we'll say done. And now we can choose pharmacy. So let's just scroll down. And you can choose, yeah, you can suggest your distance, but usually I tell people go ahead and select five, kind of select some of the big box. So Walmart, CVS, Walgreens, and let's just do three for sake of argument. Sonia, there's mail order. Okay. And now we're going to compare. So that button down there at the bottom, it says compare. Okay. And what this does is it's sorted. You'll see up at the upper right, it says sort plans by lowest drug cost plus the premium cost, which that's the way we wanted to look at this. So, wow, we picked a big drug evidently that's not it's not covered. So you probably have a heart attack if you saw this. So the premium's only $9.67 or $9.60 for WellCare, but the total cost is quite expensive, and the deductible is $615. So like I say, we picked one that wasn't covered by any formulary, and that's why it's showing such a big amount. But let's select those two and just compare. So right there, the add to compare. And we're not going to do much more, but let's compare just to show you.
Sorry, Gary, my mouse seems to be dragging a little bit.
Oh, no, it looks fine to me. So this way you can look side by side and it shows kind of the star ratings. This doesn't have any in this case, the premium, the drug deductibles, and the drug coverage, one of two. And it's showing that that first one, well, we'll see actually. So you see the preferred and in-network costs there. And if you let's hit the plan details on one of them, Sonia, and we'll just look at one real quick, and then we'll go back to the presentation. And if we go down, again, it gives you the overview, but it will tell you on the drug coverage, kind of what's going on, what drugs you're taking. There's the network costs, and there's the Walmart, CVS, and mail order at the bottom, and it says not covered, whatever that drug was. And so that's why that cost was kind of out of sight. But it also shows you the monthly cost as well as the yearly cost. In this case, we talked about max pocket being $2,100 for 2026. If it's out of network, or not out of network, if it's not covered with the plan you're in, that $2,100 you want to check and see your drugs are in formulary with the plan that you select. So it gives you kind of an idea of how the plan finder works. It's a great tool. And again, you won't have a shock like that if you pick drugs that are in your formulary. So Okay, let's keep on going. We got a couple more things to talk about. So again, the costs are going to vary on the plan. You know, are you on a generic? Are you on a brand name? Pharmacy, even location, as we talked about. Is it a tier 1, tier 2, tier 3, tier 4, or not covered, which we saw what happens on the not covered. This is what we do every day, every hour, you know, from October 15th through December 7th and beyond that. But again, this is our busy time. And so we're going to have, if you wonder kind of, well, how do I get a hold of you guys? Let's, we'll talk about that. We're going to skip the Medicare violations, I think. Well, one of the things before we get to how do you get us, our website, MissouriShip.org. If you want to learn more about Medicare and wonder how you can, one of the things I did, I retired a little early and I wanted to learn more about Medicare. So the way I could do that is I could take the training. And so that's what I did. I took the training from that Missouri Ship offers, partly because I wanted to learn more myself for a personal use, and I wanted to help other people as well. So it's a good way to do that. You can call our contact center for information about volunteering down there at the bottom, 1-800-390-3330. Be happy to talk to you about that. And we've also on our website, if we keep going, I think. Nope. Okay. Also on our website, we've got open enrollment events, if you will. So we've got different partners across the state, libraries, senior centers, you name it, that have a listing. Thank you. Sonia is always on the ball. So it tells you where you can get enrollment help. So you can call the contact center and we will get you hooked up with a counselor in your area. But we also have enrollment events across the state that you can look. And right there, she's on Missouri Ship Medicare events. And if she goes up, like right there, there's Freeman Health Systems having an open enrollment event from 9 to 1. So it gives you all the open enrollment events. You can select your region so you kind of can figure out, well, what's close. I'm in Kansas City. There's two, Kansas City Shepherd Center and Northland Shepherd Center. Both I know are close to me. So I could look and see when they're having an event and I could register for that. But anywhere in the state, you can call our contact center. And again, we will get you assigned a counselor. They'll call you. If you want to meet in person, they can arrange that. Typically, we handle a lot over the phone. We're on a video call. And so those are all options for you. So good stuff. We couldn't do this without our volunteers. We couldn't do this without our partners. And we're very thankful for both of those folks. It makes the job easier, and we're able to do it. We also have training that Sonia is showing you. So if you want to learn more, a Medicare 101 or what's going on in the area, a health screening, we've got those on our website as well. So our website's just full of good information for you, whether it's education, community events, or open enrollment. So encourage you to go out there and take advantage of that information. So with that, we're at Q&A, and I don't know if we have any or not.
Gary, I am not seeing anything in the chat, but if
Okay.
anyone has any questions or anything, feel free to put those in the chat. We've got just a couple of minutes here before our webinar is complete, and we'll be happy to answer any questions.
Yeah, you bet.
You can also feel free to unmute if you rather ask a question that way. We'll give it a minute to see if anything comes in.
Yeah. If I leave you with nothing else, review your plans, guys. Look at that annual notice of change, see what changed in your drug plan, in your Medicare Advantage plan, and just spend that hour because it could save you $2,000 in costs. and that would be a great thing. All right. Looks like we're not going to have any questions.
All right. Well, thank you all for joining us today. Thank you to Judy, Gary, and Sonia from SHIP for presenting for us today. And we look forward to seeing you all next time.
Thanks,
Thank you.
everyone.